Okay, Mom. So, hello world. My name is Robert Ransom, and I'm sitting with my mom, who is
Jean Ransom.
Jean Ransom. And the reason we're doing this is because my mom is about to have back surgery in what's the day?
It's in 8 days.
8 days. Okay. So, and the particular surgery that she's having, she could not find anything about it on YouTube, her exact surgery. So I told my mom, instead of always being a consumer of YouTube like she is, to maybe we should record it and let everybody else know what her surgery is, the procedure, the actual recovery time, and we're just going to document it so other people who may be about to have this same surgery can look at it and say, oh, that's the same thing that I'm going to have. And then you can have something to refer to. She'll be glad to answer questions and all that good stuff too. So, first off, Mom, tell me your age.
Okay, I'm 74.
And the exact surgery that you're having is called what?
A foraminotomy with fusion at L4, L5, and S1.
Okay. So L4, L5, S1. So that's lower
spine, lumbar spine. It is going to correct, hopefully, spinal stenosis, which is a narrowing of the space between the discs. And what has happened with me is I've had a foraminotomy 4 years ago. That worked to the extent that I had less pain, but it did not clear the other issues with the disc bulging and that kind of thing, herniated disc and so forth. So it's been coming for a long time, and now it's just gotten to the point where it's a little bit time. It's time to do it.
Okay. So how we got here was my mom, as she said, she had a surgery basically to clean it up, I guess.
It was to make the disc space larger so that it wouldn't pinch the nerve.
Okay. So now it's down
really small. It hurts, and I can barely stand up straight.
Right. So we noticed over the last couple of years, especially, we all did a family trip last year, and she was, but had to sit down, every few times we walked or whatever. And then since then, she's been riding in carts and things when she goes to the grocery store, when she goes shopping, when you go to wherever
they have electric carts.
Right.
I've gotten to the point where I don't even really like to go out unless they have an electric cart.
Right.
Because it's hard to walk behind a regular cart for longer than maybe 15 minutes max. And after that, I have to sit for at least 10, 15 minutes and then start again, which makes everything take longer. It's more work. It's harder.
What happens if after that 15 minutes?
It's just, it pinches so hard. In order to release that nerve, I have to bend over. It temporarily releases it enough to let it expand to where it should be. And then the minute I stand up again, it squeezes it again. So I only have about a 10-minute span in there where I don't have to sit, and that's the only thing that doesn't hurt is to sit. So.
Right. So we noticed she was bending over more and more to walk, to the point now where she literally just can't stand up straight to just walk. My brother and I, he gotten a rollator and some other things to try and help, but even that's become hard
difficult to use. It helps because it's better than nothing, but the goal is to be able to stand up long enough to walk to wherever I want to go without having to sit down, and that's not possible now.
Okay, so so that's how we got to this point. Now, her doctor recommended this.
Well, he talked about it slightly 4 years ago, but the mention of the word fusion is a bad word. It connotated to me that I would not have motion in my back, that everything would be stiff, and that everything would be irreplaceable. Once it's done, you cut those bones, and then they're irreplaceable. But what has happened over the last 4 or 5 years is that the surgery itself has become more and more accessible. It's become more and more easy to do. The recovery time is shorter. The operating site is smaller. The instruments are smaller, more precise, and more direct. and most neurosurgeons use robotics to do it. So what normally would have been from L3 to S5 would have been maybe a 10-inch scar before. Probably it'll be smaller, but it will be less painful. I hope. We don't know. Everybody's different, so we'll see.
So let's back up even further. So talking about pain, now you have a very high
Tolerance for pain.
Tolerance for pain. And your medical history, because a lot of people are going to want to know, well, what did you do to your back for it to be this bad, right? Did she play sports? Did she do this? Did she do that?
No. It started with a diagnosis of muscular dystrophy. It's been in 1988 was when that was diagnosed. My back was the first thing to go. Muscular dystrophy connotates muscular movement, and at the time, we didn't know how much this would affect the muscles in my back. Although I realized it was the first thing to go, we concentrated more on my limbs and my swallowing and just things that were more apparent at the time. Over the years, it's been getting worse and worse, but we never associated the two until now. And so now, my last MRI showed that the muscles surrounding my spine have become more and more weak. And it's also showing a little bit of scoliosis at the bottom, which that's where your spine starts to twist a little bit. And that really was what prompted me that I really needed to do this, because scoliosis is very serious. It can get, none of this is going to get better without surgery. We just hope that the surgery does what it's supposed to do, which nobody knows. But that was the reason that I was having so much trouble finding someone that had the same thing I had, because most of the surgeries, they range from anywhere from children to all the way up to 90-year-old people. So, but in my specific area, there was no one I could find that was in my age range and that had exactly what I have, because it's two problems. And now it is a muscle problem as well as a cervical. Well, not cervical, it's more lumbar. It's lumbar.
Okay. And the spine and the nerves.
The spine and the nerves are the problem that prompted all of this, but we see now that it does go back a long way.
Okay. So his initial diagnosis in terms of recovery time, once they do the surgery, did he say how long the surgery would take?
Well, no, he didn't, because once they get in, they may have to go up another disc. In other words, to L3. We hope to start at 4, which would entail 6 screws, 2 rods, and probably 2 what they call cages, which are the spacers between the vertebrae. And that vertebrae will wear down, and that's what's happened to me. Degeneratively, it's worn out. So when you put it in, it's like putting a jack under a car. It just jacks it up, gets them to where they're separated. But they hopefully we'll be able to use my own bone, which they take out, clean it up, put it back in, because fusion is not exactly what it sounds like. What that actually means is once you put that bone, my bone back, or it could be artificial bone, it could be cadaver bone, anything hopefully that will fuse together, but that just means it mends itself back to what it was. So fusion to me was a misnomer. I was glad to see that it didn't mean you won't be able to bend or twist or anything like that.
We're not doctors, y'all. We're not doctors,
no,
but we're just repeating. We're disclaiming. We're just repeating what the doctor has told
and
us.
This is my specific case because everybody's different.
Right. Okay. So don't quite know, and we'll update everybody on surgery time and everything once we're at the hospital and everything, and kind of keeping a watch of the actual time. But no. He didn't give you anything on the time that it would take to do it. But because he's unsure. He's unsure. What about recovery time? Actual recovery time.
Now that is what is interesting to me, because it could be anywhere from 6 months before the bone actually meshes together to a year. Now that sounds like a long time, but when you're talking about a body part that you're taking pieces of it out and putting it back together, you don't really know. My goal, well, he said to me, what do you want to be able to do afterwards? My goal is just to walk upright. Now, a lot of people are athletes. They want to climb mountains. They want to play ball. They want to jog. They want to. That would be a bonus for me. Walking upright and doing the things that we like to do is all I want to do. I mean, it's what I would. That would be optimum for me. Anything other than that is icing on the cake for me. So, and age has nothing to do with it, by the way. It's like he's done this surgery on people 20. He's done this surgery on people 90. So age, he said, was not a factor as to how it would be. So what I anticipate, though, judging by what I've seen and what we talked about, my doctor himself has had the surgery. He had it. He said he never looked back. The thing is, because I have a couple of things going on, my recovery time may be a little more, but that's okay. I just want to be able to walk. And walking, by the way, is the best thing you can do for it. Mm-hmm. So being able to walk for as long as I want to walk, shop, do my housework, go up and down steps. I'd like to be able to do it unaided, without a cane, without a rollator, without anything. If I have to use a cane that would be fine. But this, I feel like, might be one of those things where that less might be more, because I'm not looking to climb mountains. I just want to walk.
Okay. All right. So that's the gist of where we're starting, and it's sort of an introduction as to what we're doing, or what my mom is doing, rather. Again, I'll sort of keep a little running history of the videos, and if people have questions, or as we go along, feel free to reach out to Mom. She is going to be on her YouTube page, so feel free to reach out to her. She's always on YouTube.
So that's how you learn.
Yes, she's a YouTube University master's student. So
you don't learn everything, but you learn enough to know how to.
Yeah, but it's oddly enough, they didn't have this on there.
They just did not have it. They did not have the exact surgery. They had a lot of others. Like your dad had he had a different type of surgery to his back. He got off the table, was fine, never looked back. Mine is a little different, so everybody's different. But specifically for foraminotomy with fusion at L3, 4, and 5, 4, 5, and 4, 3, 4, 5, and S1. So that's where we are.
All right, so that's where we're starting, everyone. Again, follow along. We'll just keep updating as we go along, and we'll see you on the next one.